Your body is trying to tell you something. The anxiety that spikes before meetings, the sleep that won't come no matter how exhausted you are, the blood pressure climbing despite no family history. These aren't random inconveniences to suppress with medication. They're messages, signals, your body's way of saying something is out of alignment here. I'm Dinah, an integrative health practitioner, and today we're talking about why treating symptoms instead of root causes is keeping you stuck and what you can do about it. Let's look at the conventional medicine approach. Let me describe what probably happened when you went to your doctor. You explained your symptoms, maybe anxiety that's affecting your work, insomnia that leaves you exhausted, blood pressure readings that suddenly aren't normal anymore. Your doctor listened for maybe 10 or 15 minutes if you were lucky. They ordered some standard lab tests. When the results came back within the normal range, they pulled out their prescription pad. Anxiety? Here's an SSRI or a benzodiazepine. Can't sleep? Here's Ambien or another sleep medication. Blood pressure up? Here's a beta blocker or ACE inhibitor. This is symptom suppression, and it's what traditional medicine does best because that's what it's designed to do. Your doctor went to medical school to learn how to diagnose disease and prescribe medication. They're not failing you on purpose. They're working within a system that asks one primary question: what drug treats this symptom? Not why is this happening? Not what's the root cause? Not what is your body trying to tell you? Just what medication suppresses this symptom? And yes, these medications might give you temporary relief. The anxiety might decrease. You might sleep for a few hours. Your blood pressure reading might improve. But at what cost? The side effects. Let's talk about what happens when you suppress symptoms without addressing root causes. The most common prescriptions for midlife women are for anxiety, sleep disorder, and high blood pressure. And all three of them have a lot of side effects, often creating new problems on top of your original symptoms. Let's look at the top three, starting with anxiety medications. SSRIs can cause weight gain, sexual dysfunction, emotional blunting, and withdrawal symptoms when you try to stop. Benzodiazepines are highly addictive, cause cognitive impairment, increase fall risk, and can worsen depression. So now you have your original anxiety plus weight gain you can't explain, plus difficulty concentrating, plus a medication you can't easily stop taking. The next are sleep medications. Ambien and similar drugs can cause next-day drowsiness, dizziness, bizarre sleep behaviors, memory problems, and dependency. They don't create restorative sleep. They knock you unconscious, and there's a difference. So now you have your original insomnia cause still present, plus morning brain fog, plus dependency on a drug that isn't giving you real rest. And third, we have blood pressure medications. Beta blockers cause fatigue, depression, sexual dysfunction, and can worsen blood sugar control. ACE inhibitors cause persistent dry cough, dizziness, and can affect kidney function. So now you have your original blood pressure issue unaddressed, plus crushing fatigue, plus a cough that won't quit, plus blood sugar problems. Do you see the pattern? You start with one symptom, you get a medication that suppresses it, but doesn't ask why it's happening. Then you develop side effects that can create new symptoms, which might require more medication, which creates more side effects. This is the pharmaceutical cascade, and it's not healing. It's management at best, harm at worst. Symptoms are messages. So let's reframe this completely. What if symptoms aren't the problem? What if they're the messenger? Your body is incredibly intelligent. When something is out of alignment, it sends signals. Symptoms are your body's way of saying, hey, something needs attention here. Anxiety isn't a Prozac deficiency. It's often a message that your cortisol rhythm is dysregulated from chronic stress. Your gut microbiome is imbalanced. You have blood sugar swings creating panic-like symptoms. Heavy metals are affecting your neurotransmitter function. You're not sleeping well, creating a cascade of stress hormones. Now, insomnia isn't an Ambien deficiency. It's a message that your cortisol is elevated at night when it should be low. Perimenopause is causing night sweats and hot flashes. You have parasites that are most active at night. Your blood sugar drops in the middle of the night. Inflammation is preventing deep sleep. Your magnesium is depleted. Now, high blood pressure isn't a medication deficiency. It's a message that you have chronic inflammation in your cardiovascular system. Your stress response is stuck in overdrive. You have insulin resistance affecting your blood vessels. You have nutrient deficiencies like magnesium and potassium. Your kidneys aren't eliminating toxins efficiently, or your diet is creating inflammatory responses. When you suppress the symptom with medication, you silence the messenger. But the underlying problem? It's still there, getting worse, getting more imbalance. Eventually, that suppressed message finds another way to get your attention, usually through a more serious symptom or diagnosis. Let's consider what conventional testing misses. Now, let me address the experiences you probably had when your doctor gave you your drew your blood tests. You got your blood drawn. Maybe they checked your basic metabolic rate, your lipid panel, your thyroid, probably just the TSH, and maybe the complete blood count or CBC. Everything came back normal, and your doctor said, see, you're fine. It's probably just stress. Here's a prescription. But here's what those tests don't show. They don't show your cortisol rhythm throughout the day, whether it's spiking at night when you're trying to sleep or flatlining in the morning when you need energy. They don't show gut dysbiosis, the imbalanced microbiome affecting your serotonin production and creating your anxiety. They don't show food sensitivities creating systemic inflammation that elevates your blood pressure and disrupts your sleep. They don't show nutrient deficiencies, the magnesium, the B vitamins, the omega-3s, all essential for a calm nervous system function. They don't show heavy metal toxicity affecting neurotransmitter production. They don't show parasites creating the anxiety, sleep disruption, and inflammation you can't explain. They don't show insulin resistance in its early stages before it becomes diabetes. They don't show inflammation markers that predict cardiovascular disease years before it happens. These conventional tests are designed to detect disease, to answer the question, are you sick enough to treat? They are not designed to detect dysfunction, to answer the question, why are you experiencing these symptoms? This is why you can feel absolutely terrible and be told everything is normal. Because normal ranges are population averages, not optimal function, and dysfunction exists long before disease appears on standard testing. The alternative is the root cause approach. Functional medicine testing asks different questions, not what drug suppresses this symptom, but what is causing this symptom? Not, are you sick enough to treat, but why aren't you functioning optimally? Not, what's your diagnosis, but what imbalances are creating your symptoms? When we use comprehensive functional medicine testing, we identify the root causes creating your symptoms. For anxiety, we test complete cortisol rhythm throughout the day, comprehensive gut health and microbiome, neurotransmitter levels, blood sugar regulation, heavy metal burden, nutrient status, especially the B vitamins, magnesium, and omega-3s. For insomnia, we test cortisol and melatonin patterns, hormone levels and metabolism, gut health, inflammatory markers, blood sugar regulation, and magnesium and other sleep-supporting nutrients. For high blood pressure, we test inflammatory markers, insulin sensitivity and metabolic function, kidney function markers, nutrient status, heavy metal toxicity, and food sensitivities creating inflammation. Then we address what we find, not with medications that suppress the symptoms, but with targeted interventions that resolve root causes. Gut healing protocols if dysbiosis is present, parasite elimination if needed, detoxification support for heavy metals, specific nutrients for deficiencies, anti-inflammatory nutrition removing food triggers, cortisol regulation through targeted supplements and lifestyle, blood sugar balancing strategies, and hormone optimization if imbalances are present. When you address the root cause, the symptoms resolve, not because you've suppressed them, but because you've removed what was creating them. Let me be direct with you. You've worked too hard to accept pain, discomfort, and health risks as part of your career and quality of life. You didn't build your career, your expertise, your reputation to spend your peak years managing medication side effects and declining health. You didn't sacrifice, strategize, and climb the ladder to settle for normal lab results while you're falling apart. And you didn't earn your seat at the table to be told your symptoms are just stress or just perimenopause or just getting older. Your symptoms are messages. Your body is trying to tell you something is out of alignment. And you have two choices. One, keep suppressing the symptoms with medications, dealing with the side effects, watching your quality of life decline while the root cause gets worse. Or two, listen to the messages, identify the root causes, address what's actually creating your symptoms, restore your body's natural balance and optimal function. The dismissive experience you had with your doctor, being told everything is normal despite how terrible you feel, that doesn't have to be the only approach to addressing your very real, very legitimate health issues. There is another way, a way that respects what your body is trying to tell you, a way that seeks answers instead of just suppressing symptoms. If you're tired of taking medications that create new problems while your original symptoms persist, if you've been dismissed by doctors who can't explain why you feel so terrible when your tests are normal, if you're ready to stop suppressing messages and start addressing root causes, then I want to invite you to a discovery call with me. We'll explore how comprehensive functional medicine testing can reveal what conventional testing misses, the actual root causes of your anxiety, sleep issues, high blood pressure, and other symptoms. We'll create your personalized roadmap to address these root causes, not just suppress the symptoms they create. Your symptoms are messages. It's time to listen. You've worked too hard to settle for symptom suppression when root cause resolution is possible. The link to schedule your discovery call is in the description below. Your body is trying to tell you something. Let's figure out what it is and fix it. If this video resonated with you, please like and subscribe for more content about the real root causes of midlife health issues.